I lost my dad a year ago to cancer, and I can tell you that I would give anything to have one more day, one more week, one more year with him. Really, there's nothing. There's no amount of money that I wouldn't give to have him in my life again. Um, and $100,000 may seem like a lot of money, but to me, $100,000 is like everything. $100,000 funded a clinical trial that gave me a year and a half with my dad. And a year and a half may not seem like a lot of time, but when you're looking at missing someone forever, a year and a half is like everything. And I like to think that the $100,000 that helped to fund my dad's clinical trial or trials that he was in, it came from relays. It came from, a bunch of college students fighting the good fight. Virginia Tech Relay raises like $500,000 every year, and I like to think that the money from my dad's trials last year, it came from Virginia Tech. And so don't think that this $100,000 goal is some abstract thought. You're giving time to someone else. $100,000 gave me a year and a half with my dad. It's not some abstract amount of money. It's real, and I will be forever grateful for it. And the other thing about clinical trials is that usually when you enter into clinical trials, your backs are kind of against the ropes. Normal, or I guess you say normal treatments haven't been responsive. And that's where we were with my dad. His cancer was really smart, and it was really resistant and resilient. And after hearing so many times that, the treatment isn't working, it's hard. It's difficult. I mean, how do you keep your morale up when every time you go in for restaging, they're telling you that it's not working? And that's what clinical trials can do. They say, but, that but is everything. This isn't working, but there's this new trial, there's these new options, there's these new drugs that we can try that might work. And I think that's one of the most important things to remember about clinical trials is they don't just give you new medicine, they don't just give you time, they give you hope. And hope is everything when you're fighting this disease. And I think that the reason my dad was able to fight for so long, and the reason I was able to keep him for a year and a half, is because of the new drugs and because of the hope. It gave my family something to hold on to, something to look forward to. When he got admitted into the trial, it was huge. We were excited. It was amazing. And it really gave us more quality time that I'm going to cherish forever. And so while you're raising this $100,000 this week, keep that in mind. You're not just raising $100 to raise $100. You're raising $100 to give hope and time to someone. We will be the generation that kicks this disease, and we will do it because of the research and the funding and the clinical trials. That is how we're going to find a cure to this disease. And I'm telling you, we will do it in our lifetimes. We're going to see an end to this. And in the meantime, keep working on raising that $100,000, because you'll be giving a girl a year and a half with her dad before she has to say goodbye. And, to me, it was everything.